I used it in this 22-year-old polytrauma. He had a lot of other things going on, but his femur healed up great in a year. He was only complaining about his jaw that he broke last time we saw him. But on the other side, that's a renal cell lesion. They're notoriously lytic and aggressive. And being able to see what I was doing after you put the plates on to monitor this with time is a good benefit of carbon fiber. And there's some others that I'll get into in a moment. But late last year, this was an osteosarcoma in a young child. It thankfully spared the joint. It didn't cross his physis, so we're planning a joint-sparing resection with a size-matched allograft that I had there. But we did neurovascular dissections. You can see the hemoclips there on the right. But to secure in the graft, we spanned it with a carbon fiber nail, so I won't have any issue looking at that bridge site. The fatigue strength of these nails is another advantage. Since it's embedded in PEEK, it acts as a plastic, so micromotion wise, it doesn't have a failure if you put it on a 3-point bending. Hard to believe, but there's some other data we can go over if you drop by Carbofix's booth later. But for something you expect is going to have a longer healing time or need additional callus, this is a good option. But he's doing well. I even lengthened him a few centimeters with that graft, so it's under a lot of tension, and he's walking on it already, knowing he was going to have to go back to chemo. Another large allograft case here with an aneurysmal bone cyst in a 10-year-old. We tried a bone transport, but it didn't work as well, so the segue there was a full size match graft, but she was very small, and a nail isn't great when you worry about seeding things, and 5 months later, this is healing up excellently. The plates, I've never had a plate break. The screws are what would break first because they lock into the plate. They screw directly into it. And the same is true with the nail. The holes that they have are threaded, so it's essentially a locking screw through the nail, similar to some advanced locking screws that other implant companies will have. A similar concept, but it's inherent in the implant design here. Anytime I'm removing a cortical defect, these are benign tumors, an osteoblastoma, and then a solid aneurysmal bone cyst in an ankle. I prefer to bridge it with carbon fiber if I can, just because it makes surveillance very, very easy. If you did have to radiate something, which we did here, just like you can't see these implants on x-ray, they do not scatter radiation either. So if you have a prophylactic fracture for a metastasis that you're gonna radiate later, it's not gonna scatter your field and make your radiation oncologist very happy with you. But this guy, 44-year-old, rural Louisiana, he presented during COVID with a very large thigh mass, circumferential. I knew I was gonna strip around his femur and make it lose a lot of the blood supply it needed. And since it was a myxoid sarcoma, they respond to radiation. So we knew he was gonna get radiation later. All the more reason for me to protect his bone with a carbon fiber nail. And you can see here, that doesn't even look like the same thigh, but that's him, and that's his MRI for one of the surveillance scans, and the carbon fiber doesn't cause any artifact when I'm looking at these. The screws will, so I always will plan where those go, but it's a lot easier for the radiologist to cone in and do a metal subtraction, either a Mars study or if you wanted to get a CT, getting a spectral CT is great with these implants. And yeah, it didn't affect his radiation. Carbon fiber is also helpful when I have to combine different techniques. This was a metastatic cervical cancer lesion that was large enough. Traditional thought would have had proximal femur replacement, but she had to get on chemotherapy fast, and I didn't want to essentially fillet the thigh. So I did a radiofrequency ablation in 8 different places and put a carbon fiber nail in. With low balloons, you can move the tumor out of the way and inject cement into the femur that you can visualize around these implants. And she actually did not need radiation. On her most recent PET CT, she had resolution of the disease in her femur once she was on systemic therapy. But if she needed radiation, this implant wouldn't get in the way. and we avoided a hip replacement. Trauma, we get those as well. Subtrochanteric fractures are notorious for delayed unions. If you put cancer into the mix, it even compounds that. This is a transfer from Mississippi. She had a second lesion on the femoral neck you couldn't see. I didn't include the MRI here, but I ablated that, and then I fixed these lateral just to get a good reduction. Yeah, you can see the resonance traction pinhole there. When you're putting in interlock screws on these, it's a clever design of 4 tubular markers that you can superimpose to form perfect dots. And sometimes you can even see the hole radiographically right through the middle. Put in a couple interlocks, and she healed uneventfully, which is great when they're being transferred from out of state because they're not very easy to follow up with. This was a metal nail that failed. Also another one from fair distance away. They prophylactically fixed it a year ago, and you can see the fatigue strength of this implant, whose manufacturer will stay unnamed. Didn't really work great, and she also has seeds up and down the femur. She needed to get back on chemotherapy fast, so I didn't want to fillet her thigh. So I opened it up, put a carbon fiber nail down, did percutaneous ablations of those middle and distal segments, but again, combining cement, it's not so much the ablation, but the cement augmentation that's very easy to do around these carbon implants because you can see it all. It's another manufacturer's lateral plate up top, so you can combine this with other modalities when you need to in polytrauma settings. And she also went on to uneventful healing of this. She did have progression of her disease elsewhere, but the surgery I was able to give her was essentially just a proximal incision so that she could get back on chemotherapy. So a broad spectrum of how I use plates, nails, trauma, prophylactically, purely for primary or metastatic lesions. These carbon fiber implants are a good adjunct to have in your repertoire. And with that, we can segue to Dr. Zaran, who is going to talk more about the purely trauma side of this. If you have any questions, we'll be by Carbofix's booth later.